What is up, everybody? It's Steve the Hurricane here, and I am super excited to be sharing this webinar with you all. It's been a while since we've done a public webinar for everybody, but this one is a really important one, as my buddy Steve here from Celo is going to be talking about the HIPAA-compliant messaging for the home care teams and the importance of keeping this compliance when we're communicating back and forth with our caregivers, sharing that patient information. It is so vital that we are compliant because we want to reduce our liability. We want to reduce our risk. And in this day and age, information is shared at light speed, click of a finger. Every person can send a text message. They can do this, they can do that. Everybody is susceptible to getting attacks on their phone and whatnot and getting information stolen from them. And so Steve is going to go through things that you can do to reduce the liability of anything slipping through the cracks and becoming a major liability for your organization. Now, I'm excited to introduce Steve here, but before I do, I also just wanted to tell everybody that I'm excited about a bunch of different things. Here we are, we're coming up on the end of 2022, and normally, for those of you who followed me for many years, you know that I normally finish the year with the finishing whatever year it is strong webinar. I didn't do that this time because there's enough going on. You got a lot on your plate, and I wanted to really shift focus on this. But one thing I do want to remind each and every one of you is about the magazine. The Home Care Evolution magazine is coming out on December 1st. So for those of you who are subscribed to it, it's going to hit your inboxes on December 1st. It is absolutely fantastic. Again, we have 8 articles that have been written by 8 industry experts, leaders like myself. We have Todd Austin, who's the CEO of Home Care Pulse, who wrote an article in there. We have Scott, who is the CEO of SmartCare, talking about optimizing and using the fullest advantage of your technology in your organization. We also have other individuals, Bob King, who is an elder law attorney, and he's writing about legality and protecting yourselves and working with your patients, and so much more. Great client feedback. I wrote the conclusion to the 4-part series on how to scale your business to $10 million and beyond. That's in there, and so it's coming December 1st, which is a Thursday. It'll hit all of your inboxes for all of you registered. For those who are not registered to receive it, all you have to do is go to my website, which is homecareevolution.com/magazine. homecareevolution.com/magazine. And that's where you can register to receive the next issue of it, as well as access the previous 3 issues that have come out earlier this year. And so now, without further ado, let me go ahead and turn it over to my buddy Stephen Vlok. He is the CEO of Celo, and they are a company that specializes in HIPAA compliance messaging. And so he's got a fantastic presentation for you. If you have any questions during this webinar, at the very end, Stephen will answer any questions that you have. I highly recommend where you see on the top right of your screen, you'll see the little go-to webinar panel there, and you'll see where it says questions. Just open that up, type the question in at the very end. You know, Stephen's probably going to present for about 40-45 minutes, and then we will take any questions to wrap it up here, and then he's got a message for all of you. So, Steve, take it away, my friend.
Hey, thanks very much, Steve. Really nice to be on the webinar. And yeah, as Steve said, I'm Steve Vlok from Celo, and really excited to be here and to be presenting to everybody. Just a couple of notes. Feel free to ask questions as we go. Happy to be interrupted if there's some important questions. And my friend Steve will keep an eye on the questions and be sure to sort of break the discussion up. Main purpose today is to really just explore the use of instant messaging in the home care space and address any concerns or questions that anyone might have about your obligations to be HIPAA compliant. So Celo is a HIPAA compliant messaging app built for home care teams, and we are operational across the globe. And today I'm going to really focus on the home care use of our product. So just a quick check, just making sure everyone can see my screen, hoping that I've got no technical issues. Okay, so I'm going to start off with things around communication in care teams and talk about the critical nature of communication in care teams. So we can think about that communication happening in a few different spaces. We can think about it happening between the operations and the care teams. So thinking about allocating shifts and getting staff to the right facilities or the right homes, and really coordinating the care of those teams to look after the clients. The second one is really communication within and around those care teams. So if you think about a client or a patient that's being looked after by a team or by an organization or by multiple providers, really making sure the communication amongst those providers happens seamlessly and instantly as well as securely. One of the things that we find in our home care and home health customers is that these teams are usually highly mobile and very, very busy. So it's easy to very quickly want to pick up the phone and talk to someone or send them a text message, and responses are often needed in a very timely manner, and the content shared is often confidential. So if you think about the type of information being shared as an audience, just reflect on that as we go through the presentation today. Think about the types of content that your staff and your organization is sharing with each other. So as we sort of sit on this slide, I want everyone to think about what are the types of tools that we use in our personal lives to communicate with our friends, family, colleagues, and the types of things we're all going to start thinking about is our smartphones, sending a text message or a Facebook message or maybe a WhatsApp or an email. And all these tools get used in our day-to-day personal lives because they're really, really easy. So if you think about your workforce in the home care space, it's not uncommon for these kinds of tools to start to creep their way into the healthcare or home care setting because they're so easy to use. And it's just, pick up your iPhone or pick up your Android and send a quick message to someone to say, hey, what do you think I should do about this? Or you might pick up your phone and snap a quick picture of a patient or a client to want to share that image or have a look at it later with a colleague. So first thing I want to dive into is, well, what's wrong with WhatsApp or texting in a home care or a healthcare setting? So WhatsApp, SMS, email are all great consumer tools that are really, really easy to use, but they do not safeguard protected health information in a manner that's required by HIPAA regulations. So one of the kind of key things to look out for is if there's no BAA, that's a business associate agreement in place, it's not a HIPAA compliant product. So forget about things that you hear like end-to-end encryption or encrypted messaging apps claiming to be safe for health information. If there's not a business associate agreement in place, it's simply not HIPAA compliant. And so as we think about the way that data must be protected throughout the entire journey, we think about the data being protected on the device, we think about the data being protected during transit, we think about the data protected at the server level, so where the server's stored, where is information stored. It's got to be auditable from a healthcare point of view. And we also need to make sure that whoever we're talking to is actually a verified user and we don't send something to the wrong person by mistake, which is really, really easy, like with a tool like texting or email or WhatsApp, where you can get a phone number wrong or email address wrong. So why is this important? So as an organization, we really need to think about why is this important to our business? And one of the things that we need to think about in the home care or home health space is that we don't want to get fined. So let's reduce the amount of liability we have as an organization and make sure that we look after that data in the right way. And not only think about the way we might breach HIPAA, but also think about the way we might be in breach of our licenses or our funding or our insurers or our providers when we think about a survey that we might have from the state. We really want to make sure we're meeting all the needs of the regulations, and HIPAA is just one of those needs. So although WhatsApp and SMS and email can be valuable tools to communicate, they do violate HIPAA, and this leaves your business liable with fines of up to $50,000 per day until those fines are resolved or those breaches are resolved, or civil penalties. And those civil penalties can extend right out to 1 to 10 years jail time for major breaches. So if we think about communication in the general sense, sometimes it can be really hard to get in touch with other team members to discuss the client being cared for. And some other HIPAA compliant tools that exist are often complicated and clunky, or you have to log into a system and go and use it and really, really go out of your way to send a message. So caregivers just tend to gravitate to still use consumer tools like WhatsApp or SMS because it's just simply easier to use. So let's think about what are we going to look for in a HIPAA compliant communication tool? What are kind of the key factors that we want to look for? Go ahead, Steve.
I just want to jump in for a second here, because that last slide that you had just mentioned before, we were talking about like the issues and the challenges, and just kind of putting it in like some realistic situations that I know have come up. And part of the reason why, you know, I told you earlier, but part of the reason why I'm wearing my New York Giants hat here is because, you know, I'm a season ticket holder. I love my Giants, but many of the people on this call may remember there was a player who used to be on the Giants. This is probably about like 6 or 7 years ago, and he literally blew up his hand with a firecracker, right? He was trying to light a firecracker. I think it was 4th of July weekend or something like that. And he was having fun with his family, and he lit a firecracker. He had some alcohol. He wasn't, you know, doing this, wasn't doing the right thing. He was holding it, he lit it, it blew up. The reason why I'm mentioning this, though, is because this made more than just sports news. This actually made like national news, because what happened was his hand blew up. He ended up losing part of his thumb, all of his index finger, and part of his middle finger, and he kept his two ends. So he basically is kind of like this, right? And so the reason why I'm bringing this up is because he did not have an opportunity to go to the Giants and tell them what happened and then come out and tell the media and address everything, because someone at that hospital knew who he was, took a picture of his hand, leaked it to the press, made money, paparazzi, whatever, for getting that picture. And then JPP, Jason Pierre-Paul, the individual who had his hand blew up, ended up suing that hospital system and won, because it was 100% HIPAA violation and HIPAA compliance issue. So the reason why I just wanted to mention it is because those are the kind of, and I say this, another thing, without getting into too much, I had a client who actually took care of Muhammad Ali, who a lot of people know, Cassius Clay. Muhammad Ali was the famous boxer from the 70s, and all the things that he did. He's internationally, he's one of the most famous people that ever lived, right? And one of my clients took care of Muhammad Ali when he was passing away, all the way up until the day he passed away. And they had a huge HIPAA, like, lock this down, can't do this, can't do that. And it was a nightmare for that agency. They were glad they were able to take care of him. It did help them get more business in the future. They got a letter of recommendation and everything else. But the time it took to make sure that every I was dotted, every T was crossed, it made it extremely difficult. As everybody knows, when he did go on hospice, it made national news. And eventually when he passed away, it was a huge thing when he passed away here in the United States. So again, you know, just listening to what you're saying here, talk about how it can happen. It is so easy with two examples that I just shared. The one where it didn't go the way that they had hoped, and then the other one was to make sure everything was in compliance and nobody would leak anything. It was a monumental task that had to be done. So I just wanted to just jump in there. I didn't mean to interrupt.
No, Steve, I think it's super useful to get that context, and something that we really try and educate people on is it's really difficult to get your caregivers to do the right thing if you don't make it simple. So if we think about, you know, this, I kind of put this third bullet point here. HIPAA compliant tools are often complicated and clunky, and so caregivers tend to gravitate to things that are easy to use. Just remember that if a tool is complicated or not as easy to use as WhatsApp and SMS, it simply won't be used. So you might sort of think you have a HIPAA compliant solution from a box ticking exercise, but when you get down to the nitty gritty or get into an audit situation, you know, in reality, your caregivers are actually just using texting because it's simply easier. So that's just something providers that may already think they have a solution or sort of be meeting the secure messaging requirements, but just go back and check, is your tool actually being used in the right way? So I'm going to jump into a couple of key points around what to look for in a HIPAA compliant communication tool. You know, if you decide to go with Celo, great, but this is really a tool or a little a session on what to look out for any HIPAA compliant communication tool. So the first one is obviously it's got to be HIPAA compliant. So there's a couple of key things to look out for. If you're not sure, ask the organization for an attestation, and that's simply a requirement for a HIPAA compliant messaging tool. They have to have an attestation which comes from a HIPAA endorsed regulator, and they should be confident enough to provide that letter. It's normally a one-page letter that you can provide to the organization. to actually show the certification that they are a HIPAA compliant tool. The second one is the organization must be willing to sign a business associate agreement. If they don't sign a business associate agreement, they're not HIPAA compliant. And this is really an agreement that's in place to safeguard the way that the provider, in this case, the technology provider that's actually providing the HIPAA compliant messaging, is actually promising to look after that data of your clients in the correct way and in line with the HIPAA protocols. And so if you're going to be meeting those two main requirements of HIPAA compliance, that's to avoid these big fines and civil penalties. The second main point that I really want to get across today is the solution needs to be affordable. So HIPAA compliant meshing does not need to be costly. There's no upfront cost that you need to invest as a business. It's simply a subscription-based plan that you should be able to pay monthly per organization, per user. And you really don't want to be spending more than $10 per user per month. If any solutions are priced higher than that, they're overpriced, and you really need to figure out what you're paying for. So HIPAA compliant messaging is really an affordable way of keeping things easy to message between your staff, and doesn't need to be something that breaks the bank. The third point here is do not get locked into a lengthy contract. So you have to find a solution that works for your organization, and you really need to find a solution that you can very quickly to see and show the value. And most providers that really see value in their own product won't make you lock into a guaranteed length of contract, because once you start using their product and you find value in it, you're going to stick around. So there's no point in having any sort of golden handshake or handcuffs to keep that contract locked in. The third and most important step to look for is really ease of use. So make sure you choose a tool that requires no training, so your staff can start using it straight away without any extra help. And it should be just as easy, or if not easier to use, as SMS or texting. And so if you have this easy to use tool, you're going to get better staff engagement, and then you're going to ultimately get better care for your clients and your patients. And the third and final point on that is make sure you ask for case studies and testimonials to make sure you choose a proven product that works. You're too busy as an organization to use a product that is not proven, or to be a guinea pig or an experiment. So make sure you choose something that is well vetted and has some great testimonials and case studies to show that it's been used already by other organizations similar to yourself.
Now, Steve, I have a quick question for you there. Just go back to that slide 3 right there. So you were talking about like easy to use. And so like one of the challenges I know that like many of my clients have had over the years with it is that a lot of like softwares like ClearCare and other ones, they have the ability to do this, but the challenge that they're having is getting the caregivers to do it, right? Like in the office, we will do it, and it's easier for us to manage it because I'm the owner or I'm the executive director and I'm working with my staff daily and we understand it. But when the caregiver's out on their own and they're taking a picture or something on their cell phone and they send it to us, they can't do that, right? And so to get them to do it through the system is a big challenge. So like, I get what you're saying here with it, it's got to be easier to use and everything, but like, what are your thoughts? Or I don't know, maybe I'm jumping ahead here, but I know that that's something that is a pain point for a lot of us is getting the caregivers compliant with it, because they're going to kind of do what they're going to do and we don't see them every single day, right? So, I see what you're saying here. It's got to be easy to use, but can you just touch on that a little bit more? Or how do we get the compliance? Because that's the key. How do we get our external staff compliant with following through with something? Because they simply don't.
Yeah, so great question, Steve. So there's two kind of approaches to this normally, and what we see generally is that we have the top down, so we can have the executive team mandate a product and say you have to use this product when you work here. And what we see is generally, depending on the organization and the way that mandate is put in place, we have some compliance with it, and it might last for a little while until things just get a bit too complicated, and then people kind of go back to their old habits. And then the other model is really bottom up and giving your staff a tool that they really want to use and that they love to use. So some of the key things that we look for is don't overcomplicate the product. So think about the requirements of what you actually want. So if we think about HIPAA compliant messaging, All we want is a tool that people can easily send a message to each other, either one-on-one or in group or a photo. We are highly mobile, so it has to work really well on our smartphones, our iPhones, our Android devices. And we also don't want to log in and log out of it all the time. So, we don't want to be sitting there putting a username and password in every single time we want to send a message to a colleague. And so that's where things like Face ID, Touch ID to get in the app, things that are really intuitive and don't feel like a chore for the staff member or the end user to use, can start to make things really simple. And I'll talk about that in terms of how the Celo product handles some of those things in a second. So as we get into why Celo, first point I want to make is we're a proven product. So here's a testimonial from a site that we have out in California, 150 staff. This organization is in both home care and home health. And really they had a really, really quick uptake of the Celo product. Their main task was to get rid of texting and WhatsApp that they knew was happening in their organization. They actually had a patient management system or a client management system that has some embedded secure messaging in it. But the same thing as Steve was just talking about, what they found is a lot of their caregivers wouldn't have the time to go in and sit down and then just log in and create a message in those systems. All they want to do is pick up their cell phone, send a quick message, and so they were falling into the trap of going to things like texting and WhatsApp. So we rolled out at Universal Home Care. We had 92% uptake in the first week, and now we're seeing around 30,000 messages exchanged per month between those team members and between their ops staff. So really great example of a seamless and smooth implementation of the Celo product.
Could you just
a little bit
again? I don't mean to interrupt. I just want to stay on that real quick, that last slide, and then I'll continue to move forward. And I know I don't want to slow you down, because what you're saying here is making a lot of sense, right? Because from my perspective, I know I'm working with 175 agencies as of today. I've worked with 1,000 agencies over the last 10 plus years, and the biggest thing that I see on this screen right here was that 92% uptake in the first week. Can you just touch a little bit on like what was how did you get the care 150 staff? So that means 150 caregivers working for this agency. Just knowing sheer numbers, that's about 100 patients that we're talking about. So I don't even have to get into dollars and cents and revenue. I know all of that. This is not your typical home care agency. This is a little bit on a larger scale agency, right? But how did you get 135 out of 150 caregivers to adopt this in the first week? Because that's where, like, everybody on here listening right now, I know they're going to be like, yeah, my caregiver, you hit the nail on the head. They don't want to have to log in every time they do it. They don't have to leave this and go to that and remember a password and all. They don't want all that. So how the heck did you get 92% comply with this in that first week? Because that seems, be real, that seems like pie in the sky for most of us, right?
Yeah, absolutely, Steve. So I'm going to just skip to this slide. So talk a little about how we onboard. So we have a tool that we've developed called instant onboarding. So effectively what we do is we create all the profiles for your caregivers for them. So we set up their name, their role, their department, all their connections, and we create this directory for your organization that on day one, when you implement Celo, we send out an invite to all your staff. That invitation goes via email, and then we also have a dashboard where you can keep track of how these invites are being opened and accepted. And the first time the caregiver downloads the app, logs into Celo, it's only a one-time thing. So the first time they log in, everything's already set up within the app, and then they put a 4-digit PIN or a Face ID or a Touch ID in, and then any future access of the Celo app, they don't have to log in. They just use their Face ID or their Touch ID to get in. And the other key difference here is once they're in the app, they've already got the directory of all their colleagues to talk to. So one of the key differentiators between us and maybe another messaging product is we can often have the really excited early adopters that download the app. They get really excited to start communicating like this, and then they go, okay, I want to talk to Steve now. And then they go to send a message and they're not in the directory yet because they haven't downloaded it yet. So with Celo, you've already got everybody in the directory. You can start those conversations straight away. And so the uptake is quite exponential in the sense that once you get, this first 24 hours where we get around 80% staff update, we've always got the laggards. So this 92% is rounded out over the week. But the real key thing here is we create all the profiles for them, and we don't have any heavy lifting in terms of having to log in and log out all the time. So thinking about HIPAA-compliant messaging as a feature, The really key thing here is to not overcomplicate the feature set. So think about what your caregivers and what your operations teams need to do and how they need to communicate. And don't try and choose a solution that has all the features. Just think about the features that you actually want to use, and that keeps the product really simple. So if I think about the Celo product, we have one-on-one messaging, we've got group chat, we have instant delivery. And what I mean with instant delivery is you send a message, we get a push notification that goes to the other users or the group users' devices, so they see the notification. We then have delivery confirmation on the sender side as well, so it's going to show what time it's sent and then who it's delivered to, so you get another tick to show that it's been delivered to these people. And then you also get read receipts, so you can see who reads the message at what time, so you've got really clear auditability around how those messages or those photos or the documents have been sent and read. We can also manage the workspace, so we know this industry is somewhere where you might have staff that come and go, or they might even leave for a period of time and come back. And you really want to make sure that as these people come and go, you can manage how they have access to Celo. So we've got a workspace administrative dashboard where you can invite, remove, suspend, pause usage, and that really helps. So if you've got a group of 10, 15 people in this group, and someone leaves, then you can pause their subscription, and then when they come back to the organization, they can regain access, which is really important from the HIPAA compliance point of view too, making sure that staff that have left the organization don't have access to previous information. So think about someone that has their personal cell phone or a cell phone, they leave the organization. You don't want them to take that data with them, so we can remotely wipe that data. Verifying the user, so it's really important that we verify each and every user that's in the Celo directory. And a key thing there is that once they're in that Celo directory, you don't have to share any of your personal details like an email or a phone number with each other. So you can really keep your personal life separate from your professional life. So we don't have to share our personal phone numbers with any of our colleagues in a workspace. We can also control all the client content, so we can choose how we restrict access or how we set up these groups, or who can control or see certain photographs or cases. And again, just sort of touching on the ease of use. So there's only a key few features that we really focus on in terms of making the messaging really easy. And if you think about WhatsApp or Facebook Messenger or even iMessage, all those feature sets that exist in those apps, the Celo app has as well. We've talked about instant onboarding. I want to touch on this as a little bit of a high level feature that is really specific to the home care use case. So we created a feature called Celo Broadcast, which is a really quick way to get messages that are important to staff or groups of staff. Rather than sending a group message, we can send this broadcast where we create one broadcast message, and then you choose either your whole directory or groups of your directory to send a broadcast message out to. And you can very quickly see who has and who hasn't read that message. And we see this being used for things like, filling shifts really quickly at last minute, or sending out important messages. We saw this used in COVID quite a lot, where there were a lot of policies being changed and responses that had to happen quickly. And it's a much faster way to get important messages to the workforce as opposed to email or texting, where you don't necessarily know whether someone's read it or even seen or acknowledged that message.
Steve,
Go ahead.
just a quick question on that. Just going back that one slide before with the broadcast. So like you put in like a COVID alert, for example, there. How about, would this be something that we could use to also help with recruiting, like to staff a case? So send a message out to all of my caregivers about an open shift that we have to fill tonight or tomorrow, something. I'm just trying to cover, I'm listening to what you're saying. Does it have that dual functionality? It's not for that purpose, but we could do that as well.
Oh, absolutely. So what we see it being used for is, shift allocation or filling shifts. We see it for document acknowledgement, policy acknowledgement, and then we also see it for even just morale boosting too. So you might send a friendly message to the whole team on a Friday, even if it's been a really tough week. So what we see here is any type of message you want to send to either the whole organization or subgroups of the organization that might be better suited to that particular message. We can send that message out as a blast, one-off, and then we can very quickly see who's sent and who it's been sent to, who it's been delivered to, and who's received and read it. So this example here, actually on the left, which is actually a hospital example, they use it for filling shifts, especially last-minute shifts, where previously they'd used an email. And the other thing which is really useful here is they can also build lists of types of users where You might have a particular kind of shift that's only appropriate for certain care team members. So there's no point sending a message out to everybody to fill that shift. You just send the message out to the teams or to the people that actually have the ability or the skills to fill that particular shift. And so you don't send messages to people that it might not be relevant for.
I love it. Thank you.
Wanted to touch on this. So I mean, coming back to your example, Steve, too, of the hand that got taken out by the firework or the firecracker. You know, so it's very common for us as home care providers or even healthcare providers to pick up our cell phone, open the camera, which is now a really, really good camera on phones, take a picture of a patient or a client, and often that picture can be, you know, quite sensitive. It can be, you know, a sensitive area of the body. It can be a wound. It can be something that you just don't want to mix with your personal library on your phone. So we have a secure library in the Celo app, and this really helps organizations and end users capture and store patient photos or client photos in a safe way, completely separate from your personal camera roll. And the other thing here is that the photograph is never stored on the device. It's only stored in the secure server and accessed through the app in a really quick way. So, you know, that the example where you might have someone looking after a patient, they might take a picture of a wound or a picture of something that it might be quite sensitive, and then they might share that with a colleague for some advice or with the team, and then they might leave the organization a month later. Celo's secure library helps to make sure that that photograph doesn't go with them on their cell phone when they leave the organization. It really stays with the organization and stays with that client file. I wanted to touch on this. So this is just a little bit of evidence around how you see whether your staff like or love the product. So this is an example, a home care organization that's been using the Celo product for more than 20 months. I'll just talk through what each of these lines means. So the yellow line is what we call a monthly active user. That's how many users were on the app at least once in that month. The red line is how many users were on the app at least every week that month. And the blue line is how many users were on the app every single day in that month. So of the 400 people in that workforce was sort of sitting around about 75% of the users are on every day, and the dips are the weekends. And then the red line is showing almost about 90% of the users in that month are on it every week. So it's extremely sticky. And what we want to look for is that flat line where there's constant use over a long time, which really shows that the product is being used and valued by the care team members. And probably just a little bit of an insight for those organizations that might already have a messaging tool that they believe meets the HIPAA compliance requirements. Ask the organization that provides that software to you to provide a graph like this to you. You know, ask them, how are our staff engaging or our caregivers engaging with the platform? And they should be able to show you a usage curve which shows your daily, your weekly, and your monthly active users. And the other thing that really highlights for you too, from a cost perspective, is to make sure that you're spending the money on the right software that's actually being used by your teams.
Steve, I absolutely love this. This right here is probably like my favorite thing that you've showed us so far, because I think, again, just as I was bringing up, you know, the challenge that all of us have with HIPAA compliance is enforcing. So HIPAA compliance, but then enforcing our staff and our caregivers' actual usage of it here. So I really like that. And again, you know, to every single person on here, just like you said, Steve, you know, we want to make sure that our people are using it. So if we have one, which is totally fine, like, you know, go with whatever you feel best, right? If you're using one with your software, we got to make sure our people are using it. This graphic right here, to me, was something that really jumped out, was how, yeah, you got a certain percentage of people using it monthly, but the daily use, that is staggering. You know, like, I feel people tend to, you know, oh, I'll do this once a week, I'll do this once a month or whatever, because I'm supposed to do it. But the fact that you have people using this daily here says to me that people are dependent on this and they're actively communicating the way that they're supposed to. So this way, there's less liability to my agency, right? Because my caregivers are using it like they're supposed to. We're getting all the information. We have logs of everything, and it's all set. So I really like this data here. This is something that if I'm not using Celo, which is totally fine, I want to make sure that I'm going to get the usage and the data. How many of my people are actually using this if I'm paying for this type of communication, whether it be ClearCare, another software, or another company out there in and of itself. I want to make sure people are using it. That's got to be the most important thing.
Yeah, Stephen, and probably just a thing to add on to that too is a graph like this is extremely easy for a software provider to provide. You know, it takes us 5 minutes to create this graph. So if your organization that you're using now can't give you one of these, it's probably because they don't want to. So probably just one other thing to touch on. So I've talked a lot about HIPAA compliance and about creating a communication tool or using communication tool that meets HIPAA compliance needs. The other thing I really want to touch on as well is having a communication tool among your caregivers, among your operations teams that not only meets HIPAA compliance, but also brings the team together and builds the camaraderie and the way that the team works as a team. And so this is something that we're starting to see as feedback from our organizations around staff morale, staff retention, and staff engagement. So we know in home care there can be high staff turnover. It's an extremely stressful industry. People work really hard, and often they're also on their own. So they're out in the field. They're not around people all the time. They don't have that collegial support often. And so with the Celo tool or any effective collaboration tool, it's a really great way to keep your staff engaged and feel like they've got a shoulder to lean on, or someone asks for advice or questions, or even just some support in a way that's really, really easy. And so what we see, even with the broadcast example, is it's a great way to check in on your staff. How's your week been? I know you did a few extra shifts this week. Is everything going okay? And what we really see on that too is it's twofold. You look after your staff, and you keep them happy. Ultimately, they're going to look after the clients in a better way, which is really great for your business. And then it's also a great way to show how you're looking after your team and your staff when it comes to audit time around certain HR or human resources legislation or criteria that you need to meet. So a little bit about types of organizations that are using us. So we're not just home care and home health. We're also used right through the health system. So busy hospitals and primary care, pharmacy care. And yeah, I really want to pause there and take the opportunity to ask any questions from the audience that we might have as well, or cover anything we might not have touched on.
Awesome. Well, Steve, thank you so much for this. I mean, this was fantastic. I really appreciate what you put together here with it. I don't have any questions, but I think part of it is because I was asking the questions that I'm sure people had throughout. Because again, at the end of the day, when I think about HIPAA compliance, and when you spoke at the Home Care Evolution conference earlier this year in June, I remember just standing there listening to you speak, and I'm like, oh my goodness, this makes total sense. Everything that you said. And I love the onboarding and the usage by the caregivers. Like, of all the things, we're all aware of HIPAA. We all have to do it. And it's a struggle. It really is a struggle. And yes, our caregivers are trained on, they have to understand HIPAA, they have to know what it is, and they're going to do their best. But at the end of the day, we all know when they're sitting there in the house with the client and the client gets a wound, they come in one day and they see the client's got a wound. Those little pictures that you had, they get a cut on their hand, they slipped and fell, and then they got a bruise, or worse, a black eye, right? They're going to take that picture, they're going to send that picture to us, and it's like, oh, and we don't want it to stay in their cell phone, and we don't want it, they can't share it, on the WhatsApp or whatever way that they're doing. We want them to be compliant. This was something that made a lot of sense to me. And again, the usage of it, the fact that the caregivers are using it, that's what really jumps out to me. So, I'll reiterate it, for anybody, if you want to have a demo with Steve, I know, Steve, you got maybe a special promo or something that you want to share with everybody here. If anybody does want to have a demo with you about it. But the biggest thing that I took away from this is making sure that we have our caregivers using it. I think about the business owner, the home care agency business owner is already stressed out. There's so much that we have to be responsible for, and chasing people, reminding people to do, and part of my language, right? Do your effing job, right? That's the, I know everybody listens this, what I'm saying, right? Yeah, that's exactly how you feel. It's like, I got to remind them every single day. You can't do this, you can't do that. That has got to be like the biggest pain point that we have as owners. And this seems like a solution that'll get them to be compliant, communicate with us, and they're going to actually use it, because that's the bottom line with it. So I absolutely love it here. So Steve, do you have a promo or something that you can offer if people want to have a demo with you, or what? How's this all work?
Yeah, absolutely, Steve. So yeah, we've got this book a demo link here. So yeah, scan the QR code or visit hello.celohealth.com/demo. And we really are quite keen to take anyone that's interested through a quick demo with our team. And then we've also got some special pricing and free trials available as well with our Homecare Evolution partnership. So yeah, as again, you know, if you recall some of the earlier slides I went through, in terms of affordability, you don't want to pick a solution that locks you into long contracts and doesn't show the value. So we allow people to try us out first as well. So, you know, if it's something that you want to just check that works for your team, there's the option to do that. And you know, our results speak for themselves. So we have extremely high engagement. The teams love using the Celo product, and then, you know, the no training criteria component really helps implement Celo really quickly. So there's no burden or large overhead for the organization to go through.
I love it. I love it. Well, Steve, thank you so much, and everybody else out there too. Just like Steve said that he's got special promos and stuff here. I love that. You said, try it out, kind of an option there, which I think is just, you know, risk-free or whatever for everybody to just take a look at it. And then the no commitment, I also think, is huge as well. It's just, again, one of those things that if we can get our caregivers to be more compliant, and I'll take it another step further, right? Something that I train in my classes. Some of you are clients, some of you are not clients, and that's fine. But those of you who are clients, you know you're in my classes. And I always talk about in the classes, in order for us to retain our caregivers and keep our caregivers working for us longer and feeling like they're part of our organization, the communication is the most important aspect of it. And when you look at the top 10 complaints that caregivers have with why they work for the agency they do, or what they don't like about the industry and why they leave the industry, the top 10 complaints, 6 out of the top 10 complaints have to do with some form of communication. 6 of the top 10. And so if this is something that's going to make my communication, my caregivers easier, they're going to use it, they're going to be compliant, that's an additional touch. It's just something that just makes sense to me. So, you know, Steve, again, thank you so much for everything. I appreciate it. Everyone else, thank you for your time today and being here. We're going to end now. We'll send out the recording of this to everybody else. And if you want more information, you just see hello.celohealth.com/demo, or you can use your phone and you can scan that QR code and go set up a demo and take a look at it right now and bring it in for the new year. All right. Take care, everybody. God bless. Happy Thanksgiving. Steve, thank you so much. I appreciate you.
Yeah, thanks everybody. Very, very nice to have the opportunity to present. And yeah, please be in touch if you're interested in learning more. Thanks, Steve. Thanks, everybody.
Bye.